Every year, more than 7,500 Americans die from oral cancer, even though it has an 80 to 90% survival rate when detected in the early stages. Why do so many die from this curable disease? Because most oral cancers are not discovered until they reach a late-stage malignancy, which significantly boosts the mortality rate. Dentalese Group, a supplier of innovative products and services for dental health professionals worldwide, introduces Identafi, a handheld portable device that uses spectral fluorescence and reflectance technology to enhance visualization of mucosal abnormalities, such as oral cancer or premalignant dysplasia, that may not be apparent to the naked eye. Designed for use during conventional oral examinations, Identafi assists dentists and hygienists with the early and accurate detection of oral cancers. This module will explain the science behind this remarkable product and show how it enables clinicians to save lives by detecting potentially malignant lesions before they reach the life-threatening stage. Most dental professionals who regularly screen their patients for oral cancer perform conventional oral exams that rely on visual inspection of the oral cavity and palpation of the lymph nodes, neck, and throat. This traditional method of oral cancer screening is not always accurate, and it is not uncommon for a lesion to be completely missed. It often fails to detect oral cancer until it has reached the advanced stages. The main problem with conventional oral exams is that they are conducted under white light, which makes it difficult to distinguish early-stage lesion morphology from normal tissue. As we can see in this photo taken under white light, it is difficult to distinguish the lesion from the surrounding healthy tissue. But when we examine the same lesion under violet or green-amber light, the lesion becomes readily identifiable. Let's examine why this occurs. When excited by light rays, normal tissue cells become more fluorescent and reflective. Abnormal cells do not react in the same manner because they are diseased. In other words, healthy tissue fluoresces under light, abnormal tissue does not. This difference in fluorescence and reflectance can be difficult to detect under white light. However, multispectral light, such as violet or green-amber, excites oral tissues in distinct ways that make it easy to distinguish healthy tissue from cancerous lesions, even in early stages of the disease. Violet light enhances normal tissue's natural fluorescence, creating a sharp contrast between normal and diseased tissue, while green-amber light enhances normal tissue's reflectance properties. This enables clinicians to directly observe the difference in vasculature between normal and abnormal tissue. The solution to early oral cancer detection, then, is to improve the efficacy of conventional exams by using multispectral light. Identafi is specifically designed to address the limitations of white light tissue examination. Its high-intensity LED lights produce three distinct wavelength colors, white, violet, and green-amber, that excite oral tissue in unique ways, making it easier to identify lesion morphology and potentially malignant tissue. These safe, visible lights allow clinicians to conduct 3 exams with 1 oral cancer screening: white light for conventional exams, violet light for observing tissue fluorescence, and green-amber for observing tissue reflectance and vasculature. This combined system of fluorescence and reflectance uses the body's natural tissue properties to help clinicians identify abnormal tissues and detect malignant lesions long before they reach the advanced stage. To use Identafi, the clinician performs a conventional tissue exam using the highly concentrated white light. Wearing reusable Identafi filtered eyewear to enhance visual effects and allow transmission of reflected light, the clinician then switches to violet light for a second observation. The filtered glasses block the violet excitation light and allow the observance of the tissue's natural fluorescence. When suspect abnormalities are detected, the doctor switches to green-amber light, which enhances normal tissue's reflectance properties and facilitates direct observation of the difference between normal and abnormal tissue vasculature. This combination of multispectral light increases the efficacy of the exam by providing more visual information, fewer false positives, and serves as a valuable adjunctive tool for early detection of oral cancers. Identafi multispectral system includes the LED light unit, 25 single-use disposable mirrors, plus 75 additional disposable mirrors when the product is registered, and a pair of filtered glasses for the clinician. The cordless unit, which uses rechargeable or disposable batteries, can be used to provide light in any environment. The lightweight, ambidextrous design reduces hand and wrist fatigue, and the aluminum body disassembles for easy cleaning. As a practicing dentist, your primary job is to protect the health of your patients. With the multispectral Identafi, you or your hygienist can now detect potentially malignant lesions before they reach the life-threatening stage. Identafi is simple to use. You can be fully trained by your sales rep in just a few minutes, and the return on investment is compelling. Based on $30 per exam and 3 exams per day, the system is paid for in 7 weeks and will generate $21,000 in annual income for the practice. It improves the efficacy of your oral examinations, provides real-time results, and in some cases, early detection saves lives. To protect your patients and provide the highest standard of care in oral cancer screenings, choose Identafi from the Dentalese Group.